Welcome to Skills to Pay the Bills. Please join us for an update on the Affordable Health Care Act. To help noodle through the updates, Shirley Luu, host and co-producer of The Real Secrets of Money and executive field chairman for First Financial Security, Inc., is here in the house to help us with that update. So let's welcome Shirley Luu. Shirley, thank you.
Thank you. Well, thank you for having me on the show again. I appreciate it as always. It's an honor.
Right. Well, we're at the point that we really need some updates on what is going on with the affordable health care. I understand, before we get into that, I understand that you are going to be going to the White House real soon.
Yes, actually, it came as a surprise. Next Thursday, to be exact, I'm going to be going to the White House, and it's going to be recognized as what's called the champions. Well, me and my other partners. And the reason how we got it really by accident. Everything I do is really by accident. I speak two languages, as you know, Tia,
right.
Vietnamese and English. And we felt that the affordable health care was really important to spread the message to communities. And then we also realized that, well, in the Vietnamese community, it wasn't being spread, no one explaining what it really means. So we decided to get on radio and TV and kind of in the Vietnamese community and explain to them. Well, so as we explain on the radio what the program means, and at the end of the show, like always, contact us if you have any question to come visit us. Well, my office got killed, and so did the radio television station.
Wow.
There are days where we had people stand outside, around the place, and it was just like, so we helped sign up hundreds and hundreds of folks. So
they were trying to make that March 31st deadline, or is that the deadline?
There was a lot, March 31st. And
yeah.
I even had a church reach out to me, wanted to sign up 500 church members, and I had to decline. I mean, I had to tell them go on the website because I couldn't accept something that I could not handle. Because I want to make sure that we do a quality job, and if I accept it, it will go through.
Right.
So there's such a need on that. Well, bottom line, long story short, is that I guess the White House recognized the radio station for the champions in educating the communities about those kind of things. And of course, my partner who owns part of the radio felt obligated because I was the one instrumental in also helping her, getting the message out. So that's why we're going.
Wow. Well, just tell the president and the first lady that I said hello.
Well, I hope I see the president, but I'm not sure if he's going to be there or somebody else. It's just like one of those things.
Well, that's still an honor.
Yeah.
Yeah, that's great. That's fantastic.
Yeah.
Well, I understand that, of course, the March 31st deadline is over, and like you said, it was crazy for that last week. What can we expect now with this affordable health care? There's still a lot of confusion out there. The websites, while they're not as critical, as they were back in December and November and December, there's still some things that need to be worked out. So what is your take on all this?
Well, to be honest with you, we still got a couple files that we're still working to get the process done. Like in Maryland, in some area, and even in Virginia, they are making some exception because we did report it that, hey, we tried to register and either the website wasn't available, either that or the phone was just like you just couldn't get through. And so for those, they kind of honor for us to go afterward to get the clients register. And one of the biggest misconception, to be honest with you right now, is there are still quite a few folks out there that do not have the health insurance because one, I'll give you an example here. There was a gentleman came to me and said, oh, I don't need to buy it, no big deal. I'll pay my $95 penalty fees. Well, he didn't read the fine print. For 2014, it's not just $95.
It goes up.
95 or whichever higher. So this guy's making $200,000 a year. Now, $95 or 1% of 200,000. Okay, so this gentleman, if it's enforced, he'll be paying $2,000 penalty, and still have no health insurance.
Right.
Okay, and then I've got the other spectrum where, after he realized that, oh my gosh, I don't want to pay the penalty. I want to apply.
It's too late.
Guess what? You're the only one that knows it's too late. Or
Yeah.
Most people assume that I can get it anytime. Then I've got another stack of folks that are coming to me now. Well, I decided now I think I'm going to go ahead and buy health insurance. Well, the door has been shut. The open enrollment won't be back up until October, for those individual, because you have a lot of people out there that today, they're making 30,000, 40,000, and they just felt that, well, I don't need to. It's not going to work. And a lot of them thinks that it's going to go away. No one's going to enforce it,
Right.
And it's scary, to just assume that that's happening. And so.
Well, Shirley, what about the waiver? Because I'm hearing something about that. Some people, if you have had certain, just say that you're pregnant and before November, you're going to need it. Now, can that person sign up?
Yes.
There are waivers for certain situations.
Thank you for bringing that. That is correct. There are exceptions to the rules. I call it somewhat life-changing events. All right, you're married today, you may have gotten divorced. Okay, you just got married.
Okay.
You just had a baby. You just changed job, transitioned to another job. Or you just got laid off a job.
Right.
Where there are certain things that are changing your income.
Right.
1 minute I'm at this income, but next my income has changed. So any kind of those changes that happens to an individual, they are allowed to go and make the changes with the current plan. But there are unique things that is coming for the business owner.
Oh, okay.
Yeah,
So what's coming up for the business owner?
Well, starting April 1st, business owner can now start enroll their employees in their companies into the affordable health care. And it's interesting because I plan to do a lot of reach out to a lot of business owners, because I don't think anybody out there is getting in front of the business owner and sharing them what's going on.
Yeah, I think you're right.
Yeah. And so, for example, let's say you're a business owner, you got under 50 employees.
Right.
What if I came to you and I said, Tia, you realize that if you help your employees with the health insurance, you would get some really nice tax write-off part of it as well. Okay.
You would have my attention.
Right. And how much of it? Okay, depends. Maybe 30%, maybe 40 or 50%, which is pretty cool, right? And at the same time, your own employees can also qualify for government subsidies. Did you know that?
No.
So even though you're providing the health insurance benefit piece of it, but the employees themselves, if they make certain income, they can also qualify for subsidy. So it's really a win-win situation. And again,
well, is that an update? Is that updated from how it was before?
Yeah, And,
wow. Okay.
Yeah. So if the employees make certain level income, let's say 30,000 and below, then they have that. Again, they got what buts and if. Well, what if I have 90, more than 50 employees? And I mean, this whole dynamic of the insurance on the healthcare for a business owner, that is important for them to do research and to reach out to people who specialize in that.
Right.
Yeah,
that's right.
Them out, yeah.
Right. So they need to start doing that sooner than later. Would you say that?
And the other things about the enrollment is this. So you're the business owner. Let's say you said, you know what, I'm interested in signing up. Well, first of all, the website's not available, audience, for you to be able to sign up on the website. Okay. That's the most important thing that you understand. However, we can do what's called manual paperwork, manual app.
They are allowing that now?
Yes.
Okay.
Yeah, they're doing allow the manual app, so that you can get in the manual app, at least get it in there and then understood and all that.
Oh,
and like I
okay.
said, it's one of those things where it's really important to really sit down with someone that said, okay, well, how many employees do I have? Especially how many full-time employees do I have? Who do I want to cover and all those stipulations it requires in the affordable health care. Yeah.
Right.
And on a different note, Tia, the other night I was searching on the internet, and then suddenly I saw advertising, do you need health care?
I was going to ask you that. That was a question. Where a lot of companies out saying that they can beat the Obamacare by, I heard one person say 70%.
I know.
And I wondered, is that true? I was going to ask you that.
You know me, right? One of the things I like to do is I pretend to be the very naive person calling them, right? So I decided, oh my God, next thing you know, I got a flood of calls. Well, when you put your name into these websites, first thing is that everybody's calling you, right? So then I said, okay, well, I'm going to play the games. Cool. So she said, do you need health insurance? I said, well, I thought it closed out. Oh, no, you can still get it. And I said, really? And I said, okay, so tell me what my cost is. And she goes, what's your zip code? So I gave her the zip code, right? And as soon as I gave her the zip code, she said, oh yeah, well, I think you can get this other company, you know. And I goes, really? I said, because that's funny. I don't think that company, from what I heard, are not allowed to sell in that jurisdiction. So you mean to tell me I'm going to buy a company that's not allowed, you know? And she goes, well, I don't know about that, but you know, and so it was really, and then you know, it was just like they couldn't answer the question. I said, are you sure? Are you guaranteeing me? And I said, by the way, what about the discount? Oh, well, you know, it's not, you know, so it's like, it's not even real, you know, in a lot of cases. And I think they do that as a teaser to get the people in, kind of talk about, you know, and a lot of time when they advertise that, they say, well, that's because with a government subsidy, then we can say we have a discount. Well,
that's so much more confusion.
I know,
you know, being put into the system, and people are already confused enough.
And I think because they're using that, if you qualify, you know, with the government subsidy, yes, you can get, you know, substantially less of what you have to pay. So they're using that as a vehicle to say, oh, you know, this is how much you can get.
Shirley, we have a couple of more minutes before the break, but off the top of your head, I know you didn't bring any statistics in here. About how many people did you sign up over this, say, past year?
Oh, you mean the past 3 months?
Well, even the past 3 months, yeah.
Yeah, we really didn't engage in it until like the past 3 months. But I think between the radio station and us, we probably signed up close to 1,000 folks.
Wow, that's amazing.
But
the need is great.
Yeah, but which was not even nearly enough as the number of people's. You know what's scariest part?
What?
Come October, the next sign up.
Yeah.
This time, the good news is I've got a lot of municipality, operation government agency out there, and everybody, you know, is opening the door for me to go out and educate local folks and said, okay, you know, come here at this time, you can learn about this and can sign up, and just do more of a truly outreach program. And of course, I got a lot of own initiative that I will do that.
Right. So what you're saying is that the education piece is really important, and that we need to start it early rather than later on that. I agree with that. Well, it's time for a station break. We will be right back with our special guest, Shirley Luu. So don't touch that dial. We'll be right back.
Join our mission to proclaim the gospel of Jesus Christ. Every week, we feature a medley of gifts from artists, performers, ministers, and more. Experience the Lord's everlasting light in the cool of the day.
Welcome back. You're watching Skills to Pay the Bills. Our special guest is Shirley Luu, and she's here with us today to provide an update on the Affordable Health Care Act. Shirley, what else would you like to share with us?
Well, one of the things is that I think it's really, really important that with the next roundup, when the registration starts again in October, I would highly, highly encourage the fact for people to sign up. I mean, I hear the news and I hear the media all the time talking, oh, it ain't gonna happen. You know, it's like people living in a world of they think this whole healthcare thing is going to be repealed.
It's the law of the land.
It's
right?
It is the law of the land.
Law of the land.
And they think the Supreme Court is going to basically say, you know what, we're going to scratch everything. I don't think it's going to be scratched. I think the train has taken off. Now, I do think there's a modification will be needed to be done.
Right.
You understand?
There's some quirks that need to be fixed.
But I don't think it's going away. This is the direction that the country is heading. And so like it or not, I think people need to learn and understand. So I truly believe the next round, it's going to be a lot more this time signed up, realizing, oh my gosh, if I don't do something, I will be hit with a penalty. And you know, and then I guess, you know, maybe you're going to ask me next, what's the penalty?
Right. That was the next thing I was going to ask you. The penalty, you know, the penalty, and I heard that $95 number that you gave before, but people are not realizing that it's $95 or 1% of what you earn, your income a year.
That's correct.
And that the $95, the 1% actually equals, and you tell me if I'm right, the 1% actually equals the lowest plan under the bronze level, I think.
That's correct.
So
you know
why not just go on ahead and get it?
You know, I had this other person that says to me, well, I don't need to buy it. And I said, how much do you make? You know, so he gave me his income, him and his wife. they didn't make a lot. They make under, $30,000, and then, had him and his kids and all that. And when I did the plan, I said, you mean tell me you're willing to pay the penalty when the cost of insurance under the subsidy, his health insurance for his whole family was like $50 a month, which is like, you can have $50 a month for health insurance coverage for your entire family with the subsidy. And instead you want to pay a penalty, and then that's when he goes, really? I didn't know that. So it's just that people are not aware, because, and you know what? The next time go around, a lot of people that make some good money didn't think they needed to call their healthcare.gov. They thought, oh, okay, I don't have to. But guess what? This time, I think you can get more bombarded even, because whether you qualify or not qualify, everybody needs to call. Right. And come, 2014, I told you the penalty is 1%, right? 95 or 1%. Come 2015, it's 1.5% penalty. Come 2016, that's another one.
Right.
So that is coming,
Well, Shirley, I think it's important at this point for you to share with us why it is so important to have a representative, and for people not to try. I mean, I know there's some people that are computer savvy, and they may know a little bit about healthcare, and so they can call up and navigate through. But there's so many other people that are not, that much into the computers, and why do people need to have an official representative to help them?
Well, a lot of folks do think that they can do online. Well, first of all, Tia, my organization, that we reach out to the community, there's no cost at all. And I think that was the other reason why we got bombarded, because we did for one and then 10 more comes. We did for one and then 10 more comes. Yeah. It was just, client were bringing lunch and food for us.
Wow.
Bobby got a bunch of bottled wines of things.
So they were so grateful that you were reaching out to help them?
They were. They were extremely grateful. Here's why they came to us. For first, it was the language barrier, but it wasn't that. But even the folks who don't understand what that means is, so if you was coming to me, I would look at your case. I would say, okay, Tia, let's talk about you. Let's put the affordable health care beside for a minute. I want to talk about you from a personal level, as in health in your family. Do you have anyone in your family that constantly needs to go to the doctor? Do they have an illness? Because if you got someone that has to take prescription all the time, and you pick the wrong plan, and guess what? They have to pay out of pocket on a lot of stuff. That could be very costly, even though you have health insurance. Right. So I want to understand best on your needs. If you said, hey, Shirley, I'm pretty healthy, go doctor once in a while, not much, then I could give you certain plans that recommend it. And I know, under the affordable health care, they talk about the bronze, the silver, the gold, the platinum, and all that. Right. Well, understand some of those plans. What do they cover? Well, you pay for what you get sometimes as well. If you're looking at catastrophic and bronze, well, you hardly get anything at all. And a lot of people thought, wow, it's cheap, but then everything's out of pocket, because a lot of plans that if you go under the bronze, you don't necessarily get the subsidy. That's what they didn't know. Okay. Whereas if you do one step up, you get a subsidy. And
the deductibles are pretty high on that bronze plan.
That is correct.
I looked at a few of them, and some of them were like $12,000. $12,000,
$6,500.
Yeah.
Whereas I can move you up to the next plan, and some of them can qualify deductibles as low as $150.
Right. So what you're saying, even though the bronze plan might have a lower cost, the deductible is higher.
And it's all out of pocket first.
And it's out of pocket first.
Yep.
Yes.
So if you go to a doctor, the doctor bill is $160. You have to cough that $160 out first, because it's part of your $12,000 deductible. Whereas if you had the next plan up,
the
silver one, the doctor bill is $160, but under the plan you pay doctor $30. So do you want to pay $160?
Right.
Or 30?
30. I'll take 30 anytime.
Yeah. And so understanding the plan, sitting with us, we help you decide what's a good plan for your family, because every family is different.
Right. Yeah. Well, Shirley, over the past year, it's no secret that Obamacare has been volatile. I mean, that's the nicest word that I can say on TV. It's been volatile. Have you seen a difference or a softening of people, say, from a year ago, or is there still a lot of negativity out there about the plan, or are people beginning to say, maybe this is not so bad after all?
Well, you can hear some more ruckus.
Oh, we are?
Yes.
Okay.
The reason is that, even though the news, the media, and everybody say you need to sign up. Remember you said, okay, the door's shut?
Right.
Well, some of those people said today, well, I want to buy insurance now. I want to buy insurance. I'll pay for whatever it is. I'll pay Aetna, Kaiser, because I don't care. I want insurance now. My daughter is going to be sick real soon, or I need to go to a doctor, whatever reason it is. I want to buy insurance. So guess what? Can I sell it? What do you think?
You can't sell Obamacare. I mean, can they go to just the private? They can't go to private?
That is correct.
Now that I didn't know. I thought they could go on their own to private.
Why do you think the door is shut? And that's the situation. Do you see when
Is that part of the law?
It is. And do you see why I sit in front of audience and I tell this and they're all like, no.
Yeah.
And I go, yes, no. There's a reason for it. Because if they didn't shut the door, how would they do the penalty? Think about it.
Yeah.
How would they, right? Because I can say, well, I just bought it. I'm going to hit with the penalties, I'll buy it. There's no penalty. Well, they have to have a cutoff somewhere.
Yeah.
To implement this rule, including future with employer as well. When this new whole thing rolls out, there's whole stipulation, and I'm sure there'll be another session where we can go into detail about companies. If you have from 0 to 50 employee, what happens? If you have from 50 to 99,
right.
and if that itself is whole new topics about individual companies as well. So this whole dynamic, I think, is going to change. One thing I do glad is that there's a lot of people at least have insurance coverage right now. Yes. But of course, the cost in some cases is still very, very high. But then again, the lower folks, is getting at such a reasonable price. So I don't know. It's one of those things remains to be seen, and I think you will still continue to have Republican and Democrats continue battling over it. So it's going to be an interesting event. All I know is, Tia, I'm just kind of there and say, okay, here's what it is. This is what you get, and this is what you don't get, right. And kind of be just a guidance. That's all I am.
That's all you can do. Well, what about, we heard a lot of talk about, trying to bring the young people in, that group, 26 to, I'll say, 35 group in. Did you do a lot of insurance plans for that group, or was it
not really
right under 64?
Not really.
Level? Really?
No, yeah, because I think the perception a lot of young people still
college
feel that
area.
Yeah, they still. I don't need it, and even some of them, if they're a student, and they could may qualify still under the parents.
Right. That's right, because they can stay on the parents' insurance until they're 26.
Yeah, and then a lot of companies out there today still, allowing the kids, if as long as they're in college to a certain age. So that whole dynamic of it. But again, there's a lot of folks that sign up. I believe the next time a lot of different states got burnt this time really bad. As you know, even in the state of Maryland, right. They replaced.
Right, that they're really having a tough time.
Yeah.
And then is Virginia moving towards the Medicare expansion? Medicaid, is it Medicaid expansion?
Medicaid.
Medicaid expansion.
Yeah, but here's the interesting. I know Virginia wanted it, but then they really did a pushback, didn't like the plan, and said, no, we're not going to that direction. But the bottom line is, within 2015, if Virginia chooses not to go forward with that, then federal's going to take over.
Okay.
So you want to do it? If you don't do it, I will take over.
It doesn't matter the federal government.
It's kind of like, you can come kicking and screaming, but sooner or later, again, it's going to happen.
Right. Well, Shirley, we are just about out of time, but I understand that you are going to take a well-deserved vacation with little Jade and Amanda, and I don't know if your son is going. We got a couple of minutes. Can you just take 1 minute at a time and tell us what you're going to be doing in the next couple of weeks?
Oh, I have lots and lots of excitement coming. First of all, besides the trip and all that, the other wonderful things, my son, Michael,
yes.
Michael Luu is going to be, June 1st, he will be going to Ranger School. So
Wow.
he's going to be going to Ranger
He's
School.
finished school?
He finished school. He's also on May 17th. He will be graduating from George Mason University.
Oh, that's wonderful,
with
Shirley.
a physics major
Wow.
degree, and he's
That's
also
great.
graduating as distinguished honor as well.
Oh.
Yeah, and then after Ranger School, they've already informed him that he's going to be assigned to the 1st Battalion in Germany. In the infantry division and all that.
That's
so
amazing.
he's kind of have all that going on, and also being a lieutenant of fire department. So
Right.
he's got his plate full. And of course, my daughter Amanda's, going on the trip with me and Jade.
Paris.
Yeah, Paris.
That's wonderful, Shirley.
yeah. So giving all this, and I hope hey. For those of you guys who got my number with the Obamacare that's coming
Right.
up, I need help. I envision I could hire another 200 people.
And we're going to close on that note. Shirley needs help.
I
I want to thank you, Shirley, for sharing an update on the Affordable Health Care Act with us. And I want to encourage all of the viewers to give her a call or send her an email if you have any questions about health insurance under the Affordable Health Care Act. Shirley's information is scrolling, and I know that she will have an answer for you. You can also go online directly to the Federal Health Care portal or your state marketplace portal. The federal portal is www.healthcare.gov, and the website will direct you to your state marketplace if you cannot find it. Thank you again for watching Skills to Pay the Bills. We look forward to seeing you on our next segment. Bye-bye.